What is the Affordable Care Act? The Affordable Care Act also goes by the Marketplace or Obamacare. Really, though, what nobody talks about is it's a law. It is a law that says that a federal law that says it must provide certain coverage benefits, and it also has three goals. So I'm going to reference, I'm on my phone, a couple of things. I will tell you where to find these things. You can go to healthcare.gov. You can go to kff.org. That stands for Kaiser Family Foundation. They are a nonprofit organization that provides nonpartisan information about health insurance. And I'm also going to reference hhs.gov. That stands for Health in the United States Department of Health and Human Services. So, first, what does the Affordable Care Act cover? It actually has 10 essential health benefits. We call those EHBs. I'm going to read those off to you. Number one, ambulatory patient services, also known as outpatient services. Two, emergency services. Three, hospitalizations. Four, maternity and newborn care. Five, mental health and substance use disorder services, including behavioral health treatment. Six, prescription drugs. Seven, rehabilitative and habilitative services that help those patients acquire, maintain, and improve skills necessary for daily functioning and their devices. I think I'm at seven, is it eight? Yeah, I'm at eight. Laboratory services, nine, preventative and wellness services in chronic disease management, and 10, pediatric services, including oral and vision for pediatrics only, not for full adults. So it does have, the Affordable Care Act does have those 10 essential health benefits. Now I'm going to look at HHS and what they say about their three goals, okay? The law has three primary goals. Number one, make affordable health insurance available to more people. Number two, expand the Medicaid program to cover all adults with income below 138% of the federal poverty level. Medicaid program is a federally funded program, and expanded Medicaid specifically is for those people that are have income with income below 138% of the federal poverty level. So it is a state program that provides health insurance for those certain people, individuals, and families. However, it is not expanded Medicaid through the Affordable Care Act law is not available in every state. It is only certain states. So it is up to you to find out whether or not your state has expanded Medicaid. I can tell you off the bat, two states that does not, Texas and Florida, do not have expanded Medicaid. So you cannot get health insurance through the state under the expanded Medicaid Affordable Care Act law in those two states. There are other states, but those are the two that I have off the top of my head. All right, so back to the primary goals. Number three, support innovative healthcare delivery methods designed to lower the cost of healthcare generally. So really having the Affordable Care Act is intended to decrease the costs to everybody when it comes to health insurance costs to everybody in the United States. What about if the Affordable Care Act plans? Okay, we talked about the laws and we talked a lot about a little bit of the goals. What about the Affordable Care Act plans? The Affordable Care Act plans, when I just say in plain speak when I'm talking to my clients, is quotes. Quotes are based on a few things. They're based on the zip code and county where you live. It's based on the birth dates of the people that are needing coverage. And the last 2 points are really important. How many people are in your tax family for the year that you're needing coverage? So that means anybody that you file taxes with, that will be spouse or dependents you claim. Dependents can often, yes, be children, but sometimes they are grown adult family members. So how many people are in your tax family? And number four, what is that tax family's expected income that you're going to report to the IRS for the year that you're needing coverage? So those are the four things that I mentioned when I'm trying to give my clients quotes. Pardon, I have my hearing aids sticking out. I let them know that that's how quotes are based. Why am I asking you about tax questions? Because some families qualify for tax credits. Tax credits is the government's way, the federal government's way of helping to pay for a portion or possibly all of your insurance, but it depends on your income and your the number of people in your tax family. Even if they're not applying, you still want to be truthful about this because you will get accurate rates if you're truthful. And if you're not truthful, you can actually be in trouble with the IRS. We will get into that in another video, but that's what I generally tell my clients. I also say that these plans are based on where you live. So it's state specific, and then it goes down to county and zip code specific. What's available in one county may not be available in the adjacent county. So you must give an accurate address on where you live. If you do not do that part, you will be getting your plans all mixed up. When is open enrollment? You cannot enroll whenever you want. I will address something that used to be a thing in the previous administration under the Biden administration. We had lots of people enrolling whenever they wanted because there was not documentation being checked. There was not any enforcement of people being enrolled. And unfortunately, it also opened up some fraud. I will also talk about that in another video. But in this current administration, they are now checking documentation to see whether or not you can validly enroll into the Affordable Care Act. That is specifically for special enrollment periods, SEP. If you have a special enrollment period like losing coverage through an employer, or you just lost Medicaid and now you become eligible for the Affordable Care Act, you must provide documentation to show that that happened. This is brand new in the last several years. During the first Trump administration, it was this case. It's gone back to that. This is brand new as of May 16th, 2025. You must provide documentation to enroll into the Affordable Care Act for a special enrollment period. That is only special enrollment periods. How about the open enrollment period? We call that OEP, open enrollment period. That starts November 1st for January 1st plans. There may be some changes to open enrollment, but we have not, brokers, agents have not gotten official word on what those changes will be. But as of now, open enrollment, it will still continue to start on November 1st. We are not sure when it's going to end. These plans are state and zip code and county specific. They are also network specific. So you must stay in the network. In some states, you have PPO. So you have a larger variety of doctors to choose from. You may not even need a referral. In other states, PPOs do not exist. And so you must get a referral to see a specialist. I am telling you this is a lot of information so that you meet with a qualified licensed broker agent to help you navigate these types of plans and the laws and the changes that are happening to you, or changes that are happening in the United States. I want them to be able to be available for you and explain these to you. I cannot, as a singular agent, help everybody. So it will be your responsibility to find a broker agent that you trust that can help explain your options. And also, hopefully, they're on top of the news and they're able to explain the changes that are coming up for 2026. I do expect to see changes in the year 2026 for the Affordable Care Act plans. We may also see major changes in Medicaid. We do not know. All of that is still up in the air. This is summer 2025. We do not know what's going to happen. But as things unfold, I will be certain to let you know what is going on. Back to just kind of the basics of the Affordable Care Act. It is a law. We went over the 3 goals. We went over the 3 essential health benefits and a little bit of how the basics of how Affordable Care Act plans work. I hope this was helpful. If you have questions, please comment below. I want to know your thoughts on maybe how the Affordable Care Act has been working for you. I myself am a recipient of the Affordable Care Act. That is how I pay for my health care. I have pre-existing conditions. Without it, I would be bankrupt. So I as an individual that does not have employer benefits because I'm self-employed, am grateful for the Affordable Care Act to help provide the health care that I need. But I want to hear from you. How is it working for you? Do you have concerns about the expanded Medicaid under the Affordable Care Act law possibly being gone? It may go away, or maybe the funding will cut dramatically. Tell me your thoughts about the Affordable Care Act below, and I will see you in the next video.